Hi everyone, my name is Caroline Rogers. I'm an application specialist here at NextGen Healthcare. I'm also a practicing physician assistant specializing in orthopedics here in Atlanta, Georgia. Thank you for joining us for the Lunch and Learn today. Like Wendy said, we're going to be doing a deep dive into e-prescribe as well as electronically prescribing controlled substances. I'm going to go ahead and turn off my video. I'm also going to share my screen. Can everybody see
Yep,
my?
we can see your screen. You're good.
Perfect. To start with, we are in the medication module, which many of you may already be familiar with. I'm going to go through a quick overview of some of the configurability just to give you a refresher, and I'm also going to go through some tips to help streamline your prescribing workflow. To start with, in the top part of your medication module, you can see the grid. I have my grid configured to only show me active medications, but you can also configure your grid to show inactive, pending, and deleted medications as well. The different columns at the top give me specific information for the medications within the grid. Again, this is a user-level configurable setting. To adjust these settings, you would select grid preferences and you can add or remove different columns with one click. Additionally, if you're in grid preferences, if you hover over the view area, you can see the different status medications and you can select which medication statuses you want to be able to see within your grid. On the left side of the screen, you have a toolbar. I have my toolbar where I can see the patient's condition, which includes the ICD-10 codes that have been given to a patient and the encounter that these ICD-10 codes were given. Additionally, on the bottom part of this toolbar, I can see the patient's medication allergies, as well as the specific reaction to those medications. This allows me to quickly review the pertinent areas of a patient's chart prior to prescribing a new medication. These are just a few user-level configurations that should help give you complete information prior to prescribing a new one. Now, to prescribe a medication, you'll be working in the bottom part of your medication module. To start, you will select Prescribe New, which will bring you to the medication search window. You can search for a new medication in the top, or you can work off of your favorites list. My favorites, since I am in orthopedics, include anti-inflammatories, post-operative medications, and antibiotics. It's important when you're configuring your favorites to make sure you specify the prescription information, including the SIG, the quantity, the units, the refills, and the duration, because when you go to prescribe this to a patient, then that information will automatically pull forward. If you want to add a new folder to your favorites list, then you'll select the blank folder. To rename it, you'll right-click on the folder, go down to Rename Group, and then you can type in a new name for that folder. If you want to start adding medications to this folder, then you'll search for the medication in the Find window. You'll select the dosage that you want, and you'll drag and drop it into that folder. Again, it's important to specify the prescription information. So you'll right-click, select Edit, and you can make additional changes such as adding information to the SIG or changing it. You can also specify the quantity and if you would like any refills. Once you save it, then all of that information is now saved as your favorite. To delete a medication from a favorite folder, you'll right-click again and you can select Remove, or you can move the medication to a different folder. This just allows you to organize your medications in a way that makes it easy for you to find them. If you need to delete a folder and the medications in that folder altogether, you'll just select the red X next to the folder, and that will completely delete that folder and the medications. Now, to prescribe from your favorites list, you will go to the medication, you'll double click on it, and it will bring it into the bottom part of your medication module. Again, you can see where the SIG that I have favorited automatically pulled forward, as well as the quantity, the units, and the refills. If I need to make last-minute adjustments, then I can from this window by just selecting the drop-down. Once this medication is complete and I'm ready to prescribe it, I'll click accept, and that will bring the medication into the active area of my grid at the top. Now to actually send it to the patient's pharmacy, I'll click send, and it brings up the medication review window. From here, I can see the patient's information, my information as the prescriber, the medication that I'm prescribing, and the pharmacy that the medication is being sent to. This has the patient's favorited pharmacies here, but if for whatever reason I needed to make a change in their pharmacy for this specific prescription, then I can select this button and add the new pharmacy information for the patient. Once all of this information is accurate, then I'll select send, and that prescription has now been electronically sent. I can confirm that it was sent to the pharmacy by looking in the last audit column of the grid where ERX now shows. I'm sure many of you are familiar with electronically prescribing, but I just wanted to give you a refresher on the entire workflow. Now, a valuable feature that NextGen has in the medication module is the ability to reconcile the patient's medication. We all have that patient that forgets their medication list or can't remember the specific name of their prescription. With NextGen, when you go into the area to reconcile, you are able to see not only prescriptions that were prescribed in your practice, but were also prescribed outside of your practice. Through this window, I can see any prescriptions that were filled at a Surescripts participating pharmacy in the past 12 months. On the left-hand side under EHR, I can see the specific medications that I already have in this patient's medication module. On the right-hand side, I can see prescriptions that were filled, but that have not yet been added to the medication module for this patient. If I want to add them, then I'll just select the green plus button, and that will automatically pull that information into the medication module. This is a quick way to ensure that I do have the most accurate and up-to-date medication list for my patient, which ultimately will improve the patient's safety. Now, at this point, I want to show you how to prescribe a controlled substance. The workflow is very similar to prescribing a non-controlled substance, but it requires a few additional steps based on rules and regulations for the state. It requires you to review the PDMP, which is an electronic database that tracks controlled substances for a state, and it also requires two-factor authentication, which I will show you shortly. To start the workflow, you will again select Prescribe New. It will bring me back to my favorites list. So if I go to the post-operative area and I select a controlled pain medication, then it will pull it into the working area of my medication module. I can see the SIG, the quantity, the units, and the refills that automatically pulled forward through my favorites list. When I select accept, it again moves that medication into the active area of my grid. And then when I'm ready to electronically send it to the patient's pharmacy, then I'll again select send. This is where the difference in the controlled versus non-controlled workflow starts. Since Georgia, which is where I'm in practice, requires you to review the PDMP prior to prescribing a controlled substance, we have it automatically pop up in this workflow so that I have to do that. I have a more detailed report called NARC, but it includes risk indicators and graphs. The majority of the information, though, is in the summary, where I can see the total number of controlled medications prescribed, the total number of prescribers that prescribed controlled substances, and the total number of pharmacies the patient used to pick up the controlled substance. Now, at the bottom, if I want specific information on those controlled medications, then I can see the medication name as well as other pertinent information such as quantity, date, and who prescribed it. If after reviewing the PDMP, I'm okay with all of this information, then I will select continue, and it will again bring me to the medication review window. From here, I am able to review the patient information again, my information as the prescriber, the medication, and the pharmacy. The difference in this workflow is that it requires my NextGen password again. This is the same password that I use to log into the EHR. I don't have to remember a separate password for the medication module. It also requires two-step verification to electronically prescribe a controlled substance. I use Semantic VIP because it's a free application on my phone. It will give me a 6-digit code, and I just type that 6-digit code into this window. But NextGen also supports IdenTrust and Imprivata, which uses token or biometrics, giving providers choice. So for my Semantic VIP, I am going to use my phone to get the 3-digit code or 6-digit code, and then I'm going to authenticate it. This gives me a message saying that my identity has been confirmed, the prescription has been signed, and now I'm ready to go ahead and send it to the pharmacy. Once I click send, it again in the last audit column will show me ERX, showing me that that prescription was sent to the patient's pharmacy. Now, a nice feature in this workflow is that once a controlled substance has been prescribed, on the finalized note for this patient's encounter, I can see that a controlled substance was prescribed, which I have highlighted in red here. I also can see that the prescription or the PDMP was reviewed prior to prescribing, and it automatically documents this for me in my finalized note with a date and time stamp. Now, the integration between PDMP and NextGen is completed by Bamboo Health, which is formerly known as Apris Health. This is a third-party clearinghouse for prescription management programs. It's what actually allows the PDMP to be accessed within the medication module so that I don't have to go outside of NextGen to look for this information. On this map, the states that are highlighted in gray represent states that have not yet been given approval by their state for this integration. In the bottom corner, you can see the states that have integration approval pending, and you can also see the states that have still not yet been given integration approval. Additionally, I want to point out the states in yellow. These are states that do support the integration, but they do not have state funding for the integration yet. If your state does not have integration options through Bamboo Health, or if you have questions regarding the funding, then you can reach out to your account executive to discuss further and to discuss some alternative options. Now, the last thing I want to show you is how to run an audit report for what controlled substances were prescribed, as well as if the provider reviewed the PDMP prior to prescribing these controlled substances. It is a crystal report, so if you go to your crystal reports, the specific report that shows this information is the PDMP audit report, which if you scroll down is listed. During preview, you have the option to select the start date as well as the end date. This will give you a time frame for the information that you're requesting, which is what controlled substances were prescribed and was the PDMP reviewed. I'm going to set my preferences to start in January of last year and end today. Then you have the ability to choose what providers you want to see this information on. So I'm going to choose Dr. Barclay and Wendy Coots. Once I select OK, then it pops up this report for me. Here I can see for each individual provider broken out what controlled medication was prescribed, who it was prescribed to, date and time on when it was prescribed. And then in the middle column, I can see if the PDMP was viewed or not. Since Dr. Barclay and Wendy Coots are both in our NextGen practice, their PDMP automatically pops up similar to how mine did. This report is an easy way to review if providers are being compliant with some of the state regulations and some of the rules that you have within your practice. So this was a high-level overview of e-prescribing and electronic prescribing of controlled substances with a little bit of information on configuration. If you have any specific questions regarding this workflow, then I think we are going to be accepting them in the chat.
Hey, thanks, Caroline. Great presentation. We do have some questions in the chat. I'm gonna go through them. I'm not sure we'll have the exact answers for you, but we certainly will get them. I have some panelists on as well that can unmute themselves and help out. So the first question was about how to copy med favorites from one provider to another. And we're not sure if there's a specific utility that will handle that. So we're going to have to take that question back and get some further clarification. On regarding RX refills and how the RX refill notification value is set for medications, I don't know if you can give us some more clarity in the chat. We're not exactly sure how what you're asking there. You can set refills per prescription, but I think you're asking about notifications per refills. So how the provider gets notified that a refill is needed. So if you might give us some quick clarity on that. Is the reconciliation pulling medications from the CCDA received by the practice, or is it pulling from the medications from Surescripts? And Wendy Coots, are you able to unmute and answer that question for us?
Yes. So what Caroline showed with respect to reconciliation here in the medication module, that's actually pulling the medication history from Surescripts. So Caroline, can you open up the reconcile button again for us, please?
Absolutely.
And just highlight over there on the left where it says that's pulling from Surescripts pharmacy, the medication history. Now you are able to pull medication from CCDAs through data share. That's another time, another topic, but this example that she's referring to in the medication module is pulling from the Surescripts pharmacies.
All right, thank you. If you refill a controlled substance, perhaps requested on a call and documented in a phone template, is there an automated documentation of PDMP check as there is during the office visit?
Yes, the PDMP does show up when you're going through that prescribing workflow through the phone template.
Awesome. And then Melissa asked, when I run the report, it shows nothing, even though our providers are using PDMP. So Melissa, I'm going to suggest that perhaps you open up a support ticket and maybe we get the Bamboo Help folks to help you troubleshoot that. I'm not really sure why that would not be working. Unless you have some more detail you could provide us. So we did have a question. Said I noticed that you click the send button when you send EPCS and you got logged into the PDMP portal right away. I was trying to click PDMP icon. Please advise. You should be able to hit the send button and have the PDMP report come up automatically, where you don't have to make that secondary click to the PDMP icon. Wendy and Caroline, I don't know if you want to add anything to that as well.
Yeah, this is Wendy. It's configurable. It's a configuration as to whether or not you want the PDMP to open up during the prescribing workflow, or if you want it to open up, or if you want to use that button that Caroline has her cursor on.
All right. So you're going to get the same report either way. It's just a configuration of would you prefer it to pop up automatically, or would you prefer to hit the button? And like you said, you were trying to hit the button, the PDMP icon, and if that works for you, that certainly you can continue that workflow. Or if you choose to change it, there's some configurations. There was some question about pricing on the Bamboo Health. And
I'm sorry, let's go back for a minute. I just wanted to tell you where that configuration is to make it part of the workflow. It's under practice preferences medication. There's a little section in the middle of that medication practice preference where there's a checkbox where you can say PDMP review required. That's what presents the workflow that Caroline showed, where the PDMP pops up in the prescribing workflow.
Awesome.
So that's under practice preferences medication.
Awesome. Okay. So there was a question here about costing on the Bamboo Health. I'm going to defer you to check with your account manager, and they can help you get the process started for that as well. And so that would be a great place to start. Is there a way to check for preferred formularies?
There is set up for preferred formularies, but the newest, most up-to-date workflow that we have for that is called real-time prescribing benefit, which actually Caroline is going to do a lunch and learn on that. I believe it's next week, this time next week, where we're going to cover the real-time prescribing benefit so that you'll see an estimated patient cost right at the point of care, and then it'll show alternative pricings based on, it'll show alternative medication options based on the patient's prescribing benefit manager, PBM, prescription benefit manager. So that's next week.
Awesome. Okay. Yes, please join us next week and we'll continue this discussion. Shirley asked about, could we go over the PDMP button on the med module? And I think we covered that earlier talking about, yes, so she's got her arrow pointed to that right there. So you can click there and get the same report as we described earlier. And then final question here, there was some clarity on the RX refill. This question is about RX fill, not refills, in order for the provider to get updates on fill status from the pharmacy. We must set in the RX fill notifications value of the additional prescribing detail tab. How is this value for RX fill notification drop-down list sent for meds? Do users have to choose all statuses or, for example, for each and every medication? I'm not sure we can answer this right here. We may have to do some research for you and get back. Wendy, I don't know if you have any comments there.
I'll just have to go to our product manager.
I'll have to take this to product management.
Yeah.
All right. Do we have to ask the patient permission to pull their Surescripts history?
You do have to document that. I believe that most customers put that in their consent to treat that they have patients sign, but you do have to collect that and have it documented.
All right. Yes, the link should be this. I'm not sure if the links are the same for the next learning session. Wherever you signed up for this one, you would be able to get that same link. So I would defer you back to that page.
Caroline, can I get you to scroll down on the bottom of your med module to see the bottom of your prescription pad?
Absolutely.
Is the question that we're going to follow up on, are we talking about the RX fill history down here on the bottom? If you could just type in a yes and let me know, or a no for that question regarding RX fill notification. It's related. Okay.
It's related. It's related. He said it's related.
Okay, thank you.
Okay. Okay, so we're pretty much at the bottom of the hour. We didn't intend for this to be a lengthy solution or demonstration today. We wanted to give you a high-level overview and just, again, if you have any follow-up questions, I'll direct you to your account manager. If you have questions on pricing, there is some pricing with Bamboo Health, and they can get you in touch to get that functionality set up. We certainly appreciate your time today. We invite you to come back to our future sessions. Again, we're going to have some that are clinical related. We're going to have some that are financial. So the site where you registered for this one will be available. We're also going to post this recording at that site as well. So thank you very much for your time and attendance, and everyone have a great day. Thank you, Caroline and Wendy.